India. The COVID crisis there is at a breaking point, and cases soar, and the country's medical system is about to collapse. The government is facing a backlash, and officials are preparing for conditions to get even worse. ABC's Maggie Rulli is in New Delhi with the latest.
Hey, Terry. Yeah, the need here in India is still so desperate. In New Delhi, they are trying to control this outbreak. There is a lockdown in place, and you can see they've set up these roadblocks along some of the major highways. They're trying to make sure that everyone who is out has a reason to be out. But, Terry, you can see there's still plenty of cars. It is just nearly impossible to lock down a city of 22 million people. There's no way that many people can stay socially distant. And right now, the numbers, they just keep rising. In the last 24 hours, we've seen more than 400,000 cases, more than 4,000 deaths, and every expert agrees that those numbers are being drastically undercounted. Most likely, it is 5 to 10 times more than that. And Terry, we feel that on the ground. Nearly everyone we meet has either had COVID themselves or has a loved one who is in need right now. One hospital worker that we spoke with, she told us that at her major hospital, 90% of the patients right now are COVID patients.
If everyone wants to know, how do we fix this? How do we get out of this crisis? So, do you think that vaccines are the best way to get us out of this crisis?
At the moment, yes. At the moment, yes. Vaccine coupled with, do not imagine that if you are vaccinated, you are safe. You're not. You may still contract the disease, but the severity will go down.
Yeah. This is a serious situation that they are still dealing with. And, we've met so many people that just simply can't find beds at hospitals that turn them away, saying that they don't have oxygen, they don't have ICU beds, they don't have medical supplies. Many of those people are ending up having to go find clinics led by volunteers. Sometimes we've seen them just on the side of the road trying to get help. We were at one of those clinics that was just made in a house of worship, a makeshift hospital run entirely by volunteers. And a young woman there was there with her mother. She told us that in the middle of the night, her mom was struggling to breathe. Her oxygen levels dropped. She went to the hospital. She was turned away. There was just no room. Luckily, she found this clinic. She got her mom oxygen. Her mom was doing so much better. But sadly, for many, it's too late. And these clinics are just so vital right now. But, Terry, everyone says while the clinics are vital and of an urgent need, this is not the long-term solution. What we need are vaccines. And Dr. Fauci recently told ABC News that the key to ending this crisis here in India is vaccines, getting vaccines in people's arms. That is the only way we're going to come out of this and the only way that the world is going to recover from this pandemic. Terry.
Absolutely. Maggie Rulli in the nightmare scenario in New Delhi, India. Thanks very much. We're going to talk now for more on this crisis in India with ABC News medical contributor and emergency physician, Dr. Darian Sutton. Dr. Sutton, it's good to see you. Thank you for being here on this difficult topic. So India's got a giant population, more than 1 billion people. The city of New Delhi has 22 million people alone. It seems a perfect storm for a pandemic. So how can India get this COVID crisis under control in a place that's so extremely difficult to social distance in?
Well, Terry, it is so concerning to look at these images and hear these stories because, as you know, I've been working with you and talking about this pandemic since the beginning of the pandemic, as I worked for the first half in New York City and now here in California. And I'm seeing a lot of the same things I saw in New York during the height of that outbreak of cases. I think when I look at India, we need to attack this problem from a couple of different angles. Number one, prevention. Obviously, supplying supplies as far as PPE and masks to families, as many families are living in multi-generational homes, which is increasing the risk of transmission. The second is testing. We need to be able to provide everyone with testing so that people know their status. And then obviously hospital capacity needs to be increased with makeshift hospital buildings so that you can accommodate those who need simple treatments such as oxygen. Although it is so simple, of course, it's difficult in these times to even get something as simple as oxygen. And then, of course, the most important thing, vaccines. From what we know, vaccines are preventing hospitalizations and deaths. And we need to vaccinate as many people in a crisis such as this so that we can get to an end of this pandemic, or an end of this outbreak, and then step into the next phase, which is basically stabilizing what is going on right now in India.
It really is alarming and terribly sad to look at. So there's anti-government anger growing in that country. Rightly, the government seemed frozen for weeks in the face of this, in the face of its own epidemiologists predicting that it was coming. India's prime minister facing criticism. So what does the government need to do at this point to help get this situation under control?
resources and supplies. There are many stories that are coming out of India where basic treatment for basic medical disease is becoming difficult, and that is what defines a crisis. When that breakdown happens, not only will COVID-19 become a problem, but other basic diseases that people are battling in their everyday experiences are becoming very difficult. So I think that the government should step in by providing these families with resources and supplies, and of course hospitals with the resources to be able to treat patients. And there also needs to be collaboration with other nearby countries as well as the United States with supplying vaccines and supplies so that they can get through this current crisis.
They'll need support from around the world. The World Health Organization has designated the India variant of the coronavirus as being of global concern. So a lot of people think it's a long way away. We know it's a pandemic, but really, how concerned about this India variant do we need to be here in the U.S.? What do we know about vaccine efficacy against it?
So right now, the growing information is showing, and data is showing, that the current vaccines that we're using here in the United States show effectiveness against these variants. The variant that India is currently suffering from is not something that is relatively new. However, it is something that involves two different mutations that affected or have been associated with two different surges, one here in California and another in South Africa. And so from what we can see right now, that information, plus the information of the effectiveness of our current vaccines, we don't have any reason to believe right now that we should be concerned, but we have to be cautious, especially since this is a global pandemic, obviously, and travel is inevitable. So I'm predicting that soon we will likely see that variant here in the United States.
It makes vaccination all that much more important. So, Dr. Sutton, let's turn back home here. The FDA expected to authorize the vaccine for children ages 12 to 15 any day now. Where does the U.S. stand in the fight against COVID-19? What about younger kids like my younger batch, 8, 6, and 4? What is the vaccine outlook for them?
I think that will likely come in the future, but it will take time. As you have probably know, the amount of data and research that it needed to be done in order to provide the information so that those who are 12 to 15 can be included possibly in the emergency use authorization of the vaccines takes a significant amount of time. I think what people may not realize is that when you're stepping even younger, it's likely going to be more difficult to prove the validity as well as the effectiveness and safety of the vaccine, mainly because children in that age group are getting vaccinated from other diseases. So we have to make sure that we do the research appropriately while also minding the fact that those children are getting vaccinated from other common diseases that they should be. So I think it just simply is a matter of time. Hopefully by late summer, we'll start to see more results in younger age groups so that we can apply that to get as many people vaccinated as possible.
And thankfully, the disease is not as severe, nowhere near as severe for the younger ones. A blessing in these dark times of pandemic. Dr. Darian Sutton, as always, thanks very much for being with us.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.